50s.
87% of Americans wish they had taken better care of their teeth, and more than 90% say they wouldn't know what to do if a tooth got knocked out. And that happens a lot more than you think. Joining us now is Dr. Stefan Zweig, president of the American Association of Endodontists. Doctor, how are you?
I'm great. How are you, April?
Good. So I'm surprised that, people don't know what to do if they get a tooth knocked out. What do you suggest?
Well, I mean, the first thing to realize is that, this is becoming a much more frequent occurrence. We're seeing a lot of people who have traumatic accidents. They have bicycle accidents, scooter accidents, and sporting accidents, which actually knock their teeth out. And this has happened about 5 million times last year in the United States. So, what you need to realize is that when this happens, time is of the essence. And getting the tooth back in your mouth as soon as possible may enable you to save your tooth. The first thing you need to do is actually find the tooth. And when you do, you're going to want to be very careful with it to pick it up by the crown of the tooth and try not to touch the root of the tooth. The second thing is that a lot of these accidents occur on the street or on sporting fields, and the teeth get dirty, and the teeth need to be cleaned before they're actually put back in the mouth. So we suggest that you gently rinse them with water or milk to remove the debris. And then lastly, they have to be placed back into the mouth, into the socket from which they came. Once that's done, you do need to see a dentist as soon as possible, and I'm talking, minutes to hours, to make sure the tooth is replaced properly back in the socket and that it is stabilized. And then lastly, many of these teeth will require other treatment, possibly even root canal treatment. And endodontists are specialists in doing doing root canal treatment. And we recommend that people who have these traumatic accidents see endodontists in addition to seeing their dentist to make sure that they have every chance to save their tooth.
All right, doctor, that's a lot of information, and thank you for that. But, what advice do you give people who are facing the need of a root canal or even to have a tooth extracted?
Sure. So, the first thing to realize is that a root canal is a procedure that's designed to save your tooth, and that's opposed to removing your tooth. And we know that a lot of teeth are unnecessarily removed that could have been saved by doing root canal. And so the loss of a tooth is not only traumatic, but it can actually lead to more extensive work that's very complicated and very costly. So saving your tooth is actually the best thing. There is no replacement for your natural tooth, and doing root canal on the tooth is often a way to save a tooth that would otherwise be extracted. So if someone recommends that your tooth be extracted, the first thing I would ask them is, are there any alternatives to saving my tooth? And often a root canal will do that.
Okay, excellent. Where can viewers go to get more?
Get more information. Well, you can visit our website. It's www.findmyendodontist.com. And on that website, you're going to find a lot of information about saving teeth, about root canal, and about endodontists and who endodontists are and what they do. And also, there's a search engine on that website that's going to enable you to find an endodontist near you. So we really encourage people to visit that website and get the valuable information that we have to offer.
Doctor, thank you so much for being with us today.
Thanks so much for having me.